We are here with Barbara McGee, who's going to give us some brief information about hypnosis.
Hello, I'm Barbara McGee. I'm a licensed clinical social worker and a certified hypnotherapist. Thank you.
So, could you briefly describe for us what hypnosis actually is?
Sure, there are several definitions about hypnosis out there, but I like to define hypnosis as a magnified state of focus and concentration and physical and muscle relaxation.
So, how did you become interested in hypnosis?
I became interested in hypnosis several years ago when I was going through, after a divorce. It was a very difficult and dark time for me. And so I sought the assistance from my cousin, Dr. Haroon Salute, who is an EFT or an emotional freedom technique practitioner. And it was through this simple and short process, this 15-minute process, that we were able to tap on the body's energy meridians and balance the body's energy meridians through tapping in this process of EFT. So after that process, I thought to myself as a social worker, this simple and non-traditional method of healing was something that was worth looking into. And so I sought other non-traditional means of healing, and I came across hypnosis and began studying under Dr. Reverend William Mitchell and doing some self-study as well. And I was able to take advantage of the benefits of a short and effective way of relieving some of life's challenges through hypnotherapy. And so I'm continuing to learn and to grow and to incorporate scientific hypnosis into my practice so that I'm able to bypass the lengthy months and years of psychotherapy and get patients and clients to feeling better in a few sessions.
Beautiful. We notice you have several certificates and degrees here on your wall. So, could you just briefly give us a little bit of your background?
Okay, we're talking about um, years of debt, financial aid. But truly, I am a graduate of St. Louis University. I have degrees in social work and public health. Um, After obtaining those degrees, I got licensure as a clinical social worker. And I'm also, again, a certified hypnotherapist. And I've trained under um, Dr. Tom Silver, scientific hypnotherapy. And I'm constantly evolving and learning more um, in the area in order to help my clients.
So, can hypnosis be used medically for medical treatment?
Absolutely, for medical and mental health treatment. As a therapist, I see a lot of clients with depression and anxiety, and it is very effective, and trauma as well. It's very effective in treating post traumatic stress disorder, anxiety, um, depression, and a variety of mental health concerns. As far as physically, it has already been researched scientifically and is proven and has been supported by entities like the National Institute of Health as an effective treatment modality in a lot of different physical ailments. For example, I'm certified to offer hypnosis to cancer patients. It is definitely a mind and body connection. So when you address things like stress reduction, um, pain management, then it creates an overall environment of physical and mental health, health and wellness.
So, could you tell us what a typical hypnosis session would look like?
In a hypnotherapy session, I provide my clients with an assessment, a background an intake assessment that gives me information as to the challenges that they're experiencing, the outcomes that they would like to see happen, and I do a detailed assessment of what their needs are, what their challenges are, what has worked in the past, what hasn't worked in the past. And from that session, I'm able to offer them some therapeutic suggestions in order to resolve those issues. Again, when I defined hypnosis previously, I mentioned that it's a magnified and focused state of concentration and physical and muscle relaxation. So, what I'm trying to do as the hypnotherapist is to put that client in a relaxed state so that that subconscious mind is open to suggestion. And so based on the information that I've been given during those during the intake assessment, then I'm able to incorporate those therapeutic and empowering suggestions that the subconscious mind will accept as reality. So we may need to explain what is meant by the subconscious mind as I'm talking.
Yes, please.
Um, the subconscious mind is our creative and our imaginative mind. When we're reading a book and we're reading a book and we get so engrossed in that book that we begin to cry or we're on the edge of our seats, we're operating in the subconscious mind. We're not asleep, but we're focused on that book and only on that book. To all of the distractions are becoming far and far apart away. And so, or when we're driving along and then we notice between point A and point B, we don't remember much of anything. Well, we're on autopilot in our subconscious mind, who's been guiding us and helping us drive for so many years. It's like a computer hard drive. It's getting us from point A to point B. Or perhaps we are watching a movie, and we know that it's a movie, but we just begin to cry or we're yelling at the screen because for the moment everything else is far away and we're just focused on that. We're operating in the subconscious mind. And the subconscious mind is where our emotions, our experiences are stored. And so during hypnosis, and it's childlike, which means that it accepts every suggestion as literal. So the benefit of hypnosis is that when you're in this hypnotic state, then everything that is presented is accepted as reality, which makes this so powerful.
Mm.
So if you are a smoker, and I'm giving you a suggestion that you have zero desire when you think of cigarette smoking to smoke, then you're accepting that as reality, as opposed to the conscious mind, which is going to say, well, I've always smoked, and that's the logical, analytical mind that is very limited. So during my practice, once I get you to that deeply relaxed state, we may do it through a different variety of methods, progressive relaxation, idiomotor responses, and just a variety of tools I use as a therapist. Once I get you to that relaxed state, then you're open to all of the benefits of the therapeutic suggestions that I'm offering you.
It's interesting because one of the root hypnosis comes from the root word hypnos, which means sleep.
Mm-hmm.
But the way you describe it actually sounds more like a supreme awakening. It sounds as if you're more aware and awake, just more relaxed at the same time.
It is. And oftentimes we use the word sleep because most times we associate sleep with that very relaxed state.
Mm.
So we may use the word sleep, and if you've ever gone to a stage entertainment hypnosis show, they say the word sleep. And that's only because consciously we associate that word with a deep state of relaxation, but you're actually at a heightened state of awareness and you're not asleep at all.
Well, we thank you for this few moments of your time.
Thank you.